para mahasiswa.
A number of developments in the infrastructure continue to be carried out. The needs of Polkesma students are equipped with a wide variety of facilities from academic services, internet corners, primary clinics, sports facilities, multimedia rooms, canteens, and worship places. For access to journals, reference books, and academic literature, Polkesma also provides digital libraries which have obtained an accreditation. Polkesma shows success in producing superior seats with various achievements achieved by students on a national and international scale. Polkesma collaborates with various health education institutions at home and abroad to support students' competence in the health sector. Cooperation is also carried out with health service institutions, both government and private, so that students have competence, adapt to the work environment, and are able to develop professional attitudes in their fields of expertise. Pusat Unggulan Iptex PUI, or the Center for Science and Technology Poltekkes Kemenkes Malang, was established as a form of institutional policy to improve the quality of higher education through cultural approaches, local wisdom, local materials, and community empowerment. The focus is to develop superior local ingredients base to control the incidence of diabetes mellitus. The development of Polkesma will continue to be carried out, including to produce high-quality graduates. Currently, the graduates of Polkesma are highly needed in a number of health institutions both in Indonesia and other countries. This is in accordance with the vision of Polkesma, which is to become a civilized and globally competitive health polytechnic. Around 1,700 students gathered in the multi-purpose field, main campus of Health Polytechnic of the Ministry of Health Malang. Which is located on Jalan Besar Ijen number 77C, Malang City. They are actually new students of 2023 batch in Polkesma.
Selamat datang di Politeknik Kesehatan Kemenkes Malang. Saya Dr. Muhammad Wildan, Direktur Poltekkes Kemenkes Malang. Politeknik Kesehatan Kemenkes Malang merupakan politeknik peringkat 5 terbaik di Indonesia pada tahun 2022. Saat ini, Poltekkes Kemenkes Malang memiliki 5.500 mahasiswa yang terbagi dalam 6 jurusan dan 20 program studi. Sesuai dengan visi dan misi Polkesma, kami bertekad membawa Poltekkes Kemenkes Malang menjadi politeknik yang beradab dan berdaya saing global.
Before students officially join lecture activities, they must participate in the Introduction to Campus Life for Students (PKKMB). PKKMB events start from attempts at character building through country defense activities. Here, new students are trained in discipline by military instructors. The new students are enforced to become individuals who are strong, disciplined, and have patriotic pride and love for their homeland.
Polkesma hold program pengenalan kehidupan kampus bagi mahasiswa baru, all called PKKMB. PKKMB is one of program in Polkesma for the purpose to introduce all activity in our campus, such as academic activity, non-academic activity, and also Polkesma regulation. Besides that, through this program, we also to encourage nationality, patriotism, and also character building for the student. Welcome to Polkesma. With us, your dream come true. With us, you can reach your bright future.
As vocational higher education of health, new students of Polkesma must be able to explore their potential as a profession of service to the country through their expertise in health. As health experts, these 6 departments are divided into 20 majors.
Diploma Program of Nutrition Study, Diploma Program of Nursing, Diploma Program of Midwifery, Diploma Program of Pharmaceutical and Food Analysis, Diploma Program of Medical Records and Health Information, Diploma Program of Health Insurance, Diploma Program of Blood Bank Technology, Undergraduate Program of Applied Nutrition and Dietetics, Undergraduate Program of Applied Nursing, Undergraduate Program of Applied Midwifery, Undergraduate Program of Health Promotion, Undergraduate Program of Applied Safety and Health, Undergraduate Program of Professional Education, Dietitian, Nursing, and Midwife.
Kami, jajaran manajemen Politeknik Kesehatan Kemenkes Malang, periode 2022 dan 2026, akan membawa Poltekkes Kemenkes Malang sesuai dengan visi dan misi kami, yaitu menjadikan Politeknik Kesehatan Kemenkes Malang yang beradab dan berdaya saing global. Selain itu, yang lebih penting adalah bahwa sebagai bagian dari Kementerian Kesehatan, kami bertekad mendukung transformasi kesehatan. Kami akan berjuang untuk mewujudkan transformasi kesehatan, khususnya tentang tenaga kesehatan.
As part of the Ministry of Health of the Republic of Indonesia, Polkesma has 5,500 students ready to succeed in the health transformation encouraged by the government in the health education. Polkesma becomes the front guard in an attempt to change the health system in order to be more effective and efficient in providing health service. The health transformation will bring positive impacts to the nation in terms of enhancing health quality, expanding accessibility, and reducing health disparity among regions. Therefore, Polkesma continues to strive to enhance the academic quality, both the system and academic outcomes of students.
Proyeksi pengembangan Polkesma di bidang akademik mengacu pada transformasi kesehatan yang diinisiasi oleh Kemenkes, di mana ada 6 transformasi, yaitu berupa layanan primer, sistem kestabilan kesehatan, SDM kesehatan, layanan rujukan, sistem pembiayaan kesehatan, dan teknologi kesehatan.
The development attempts of Polkesma are also conducted from the internal sector, which are the management, lecturers, and staff from 7 campuses owned by Polkesma, namely Center Campus in Malang, Campus 1 in Jember, Campus 2 in Lawang, Campus 3 in Blitar, Campus 4 in Kediri, Campus 5 in Trenggalek, and Campus 6 in Ponorogo.
Saya mempunyai tupoksi di mana membawahi bagian keuangan, kepegawaian, kemudian juga bagian umum. Adapun upaya yang kami lakukan, terutama terkait keuangan, kita tahu bahwa Poltekkes Kemenkes Malang adalah sebagai institusi BLU, yang mana salah satu anggaran yang dibutuhkan adalah pendapatan yang dihasilkan oleh institusi itu sendiri, selain kita mendapatkan rupiah murni. Karena core bisnis kita adalah pendidikan, bagaimana kita berupaya institusi kita ini menjadi menarik oleh para mahasiswa.
A number of developments in the infrastructure continue to be carried out. The needs of Poltekkes students are equipped with a wide variety of facilities, from academic services, internet corners, primary clinics, sports facilities, multimedia rooms, canteens, and worship places. For access to journals, reference books, and academic literature, Poltekkes also provides digital libraries which have obtained an accreditation. Poltekkes shows success in producing superior seats with various achievements achieved by students on a national and international scale. Poltekkes collaborates with various health education institutions at home and abroad to support students' competence in the health sector. Cooperation is also carried out with health service institutions, both government and private, so that students have competence, adapt to the work environment, and are able to develop professional attitudes in their fields of expertise. Pusat Unggulan Ipteks PUI, or the Center for Science and Technology Poltekkes Kemenkes Malang, was established as a form of institutional policy to improve the quality of higher education through cultural approaches, local wisdom, local materials, and community empowerment. The focus is to develop superior local ingredients base to control the incidence of diabetes mellitus. The development of Poltekkes will continue to be carried out, including to produce high-quality graduates. Currently, the graduates of Poltekkes are highly needed in a number of health institutions both in Indonesia and other countries. This is in accordance with the vision of Poltekkes, which is to become a civilized and globally competitive health polytechnic.
Kerangka kesejahteraan mahasiswa memaksa semua sadar dengan tanggung jawab yang besar adalah satu. Tidak bisa dilakukan oleh satu individu saja. Kekeluargaan, maka kesejahteraan kami bersama-sama saling berkomunikasikan diri dan memiliki peran penting dalam membangun rasa kekeluargaan di sebuah organisasi, yaitu organisasi HRD Sarjana Terapan Keperawatan Malang dan pengembangan pelayanan, pengabdian dan pergerakan adalah detak jantung kami. Mulai dari peningkatan akademik mahasiswa hingga kesejahteraan mahasiswa. Dengan tanggung jawab yang besar, tidak bisa dilakukan oleh satu individu saja. Maka di sini kami bersama-sama saling berkomunikasi dan memiliki peran penting dalam membangun rasa kekeluargaan sebuah organisasi, yaitu organisasi HMP Sarjana Terapan Keperatan Malang dan PROFESI.
Keep my hands on myself. Pick out dust them all, put them back up on the shelf. Kiss my little baby girl is in need. Am I coming out of left field? Ooh, I'm a rebel just for kicks. I've been feeling it since 1966. Might be over now, but I feel it still. Ooh, I'm a rebel just for kicks. Let me kick it like it's 1986 now. Might be over now, but I feel it still. Got another mouth to feed. Leave it with the babysitter, mama call a grave digger. Gone with the falling leaves. Am I coming out of left field?
Perkenalkan, saya Aulia Fahmi Al-Farizi, selaku Ketua Umum HMP Sarjana Terapan Keperatan Malang dan PROFESI NERS tahun 2024, bersama Wakil Ketua Umum Tiza Amalia. Suka atau tidak, dunia penuh keberagaman, tidak hanya dari satu sisi, tapi dari berbagai aspek kehidupan. Hal itu menjadi dorongan utama kami untuk menjunjung tinggi solidaritas dan meningkatkan pergerakan organisasi dengan adaptabilitas. Melihat kondisi tersebut, kami membawa visi menjadikan HMP Sarjana Terapan Keperatan Malang dan PROFESI NERS sebagai tonggak penegak dan penguat untuk mewujudkan mahasiswa keperawatan yang beradab, berprestasi, berintelektual, berlandaskan nilai religi, serta menjunjung tinggi solidaritas. Dan visi tersebut ditunjang oleh 5 misi yang dimanifestasikan dalam aktivitas dari 1 badan pengurus harian inti dan 3 divisi.
Tiap-tiap aktivitasnya dijalankan oleh individu-individu resilient yang menopangnya. Maka dari itu,
izinkan kami memperkenalkan diri.
Kabinet Sahitya Abhinaya.
We let the story begin. We're going out on our first date. You and me is thrifty, so go all you can eat. Fill up your bag and I fill up the plate.
Every now and then I think you might want to come show up at your door, but I'm just too afraid that I'll be wrong. I'm afraid, Ooh, I just wanna get you out the
bersama HMP Sarjana Terapan Keperatan Malang dan PROFESI NERS, kita siap melangitkan asa, membumikan makna bersama Sahitya Abhinaya.
Hari ini, peradaban baru datang menghantam sekeras batu, memaksa semua sadar bahwa kita adalah satu. Solidaritas, kekeluargaan, hingga kesejahteraan mahasiswa. Mendeklarasikan diri untuk berubah, walau kita tahu hiruk-pikuk ini membuat susah. Pagi, siang, dan malam, pengembangan
Around 1,700 students gathered in the multi-purpose field, main campus of Health Polytechnic of the Ministry of Health Malang. Which is located on Jalan Besar Ijen number 77C, Malang City. They are actually new students of 2023 batch in Polkesma.
Selamat datang di Politeknik Kesehatan Kemenkes Malang. Saya Dr. Muhammad Wildan, Direktur Poltekkes Kemenkes Malang. Politeknik Kesehatan Kemenkes Malang merupakan politeknik peringkat 5 terbaik di Indonesia pada tahun 2022. Saat ini, Poltekkes Kemenkes Malang memiliki 5.500 mahasiswa yang terbagi dalam 6 jurusan dan 20 program studi.
Ya, Assalamualaikum warahmatullahi wabarakatuh. Good morning, selamat pagi everyone. Welcome to International Guest Lecture organized by a graduate Applied Nursing Study Program of Health Polytechnic of Health Ministry Malang. First of all, let me introduce myself. My name is Tiana Rahmadita, and it is an honor to me to serve as your moderator for this enriching session today. First, I would like to welcome our special guest for today, Mr. Joel Ray Uksang Akob, DNS SCRN from Visaya State University, FSU, Dr. Erlina Zuciastuti SKPNS MKep, Dean of Nursing Program of Health Polytechnic of Malang, Dr. Arif Bahtiar as the Head of Applied Science in Nursing Study Program of Health Polytechnic of Malang, Mr. Joko Wiono SKP MKep SPCOM, Head of Nursing Professional Education Program of Health Polytechnic of Malang, and last but not least, all the participants and audiences. Ladies and gentlemen, the first agenda for this morning, we will hear our national anthem and the hymn of Health Polytechnic of Malang. The next agenda is prayer that will be led by Ahmad. So please, time is yours. Oh, Fauzan, we cannot hear you. I think there's a problem with the mic. Yeah, it's still out.
Go ahead, Mbak Tiana.
Okay. Maybe we'll.
Baik, Assalamualaikum warahmatullahi wabarakatuh.
Okay.
Let's just about together for a moment and pray to God so that today activities will be blessed and can run smoothly. Allow me to let's friends in Islamic way for the other religions. Please adjust. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Hamdu yafi ni'amahu wa kafi mazidah. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhika wa adhimi sultanik. Allahumma shalli ala sayyidina Muhammad wa ala ali sayyidina Muhammad walhamdulillahirabbil alamin. Allahumma ighfir lana dzunubana wa liwalidayna warhamhuma kama rabbayani shaghira wa li jami'il muslimin wal muslimat wal mu'minina wal mu'minat al ahya wal amwat. Rabbana ighfir lana wa li ahwina الذين سبقونا بالإيمان ولا تجعل في قلوبنا غلا للذين آمنوا ربنا إنك رؤوف رحيم ربنا لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب اللهم إنا نسألك سلامة في الدين وعافية في الجسد وعزة في العلم وبركة في الرزق وتوبة قبل الموت Rabbana la tusi qulubana ba'da id. Allahumma hawin alaina fi syakaratil maut wan najata minan nar wal afa indal hisab. Rabbana hab lana min azwajina wa dzurriyyatina qurrata a'yunil waj'alna lil muttaqina imama. Rabbana taqabbal minna innaka antas samiul alim wa tub alaina innaka antat tawwabur rahim. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Subhana rabbika izzati amma yasifun. Wassalamu alal mursalin walhamdulillahi rabbil alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullah. Thank you very much, Fauzan. Ladies and gentlemen, before we proceed, I would like to greet our distinguished lecturer for today. Joining with us, Mr. Joel. Mr. Joel, can you hear me?
Yes, good morning. Can you hear me?
Yeah, sir. Very clear.
Okay,
How are you today, sir?
I'm fine. Thank you for the
Excellent.
invitation.
Yeah, we are looking forward for hearing from you today, sir. But however, before we delve into that, we're eager to listen to welcome speech from Dr. Arif, the head of undergraduate applied nursing study program at Health Polytechnic of Malang. So please welcome Dr. Arif.
Thank you, Mbak Tiana. Good morning, everyone. Good morning to Dr. Joel Reakob. Kamusta ka po?
I'm okay.
Thank you. First and foremost, let's praise Almighty God for His blessing and guidance that have allowed us to gather here. Secondly, we express our gratitude for your support and presence, the committee, our colleagues, and all of the students, and especially the speaker, Dr. Joel Lee, who have made this guest lecture events possible. Ladies and gentlemen, I am delighted to welcome each of you to this distinguished event, our international guest lecture on perioperative nursing. It is a privilege to gather here today as we transcend borders and unite in our commitment to advancing knowledge in the field of perioperative care. Today's lecture marks a significant milestone in our pursuit of excellence in nursing education and practice. We are honored to host Dr. Joel Reakup, a renowned expert in nursing from Visayas State University, Philippines. His expertise and insights promise to enrich our understanding and inspire us to embrace innovative practices in perioperative care. As we delve into today's discussions, let us take this opportunity to engage deeply, to question boldly, and to learn eagerly from our distinguished guests. The challenges and complexities of perioperative nursing demands continuous learning and adaptation. And today's lecture presents a unique opportunity for us to broaden our perspective and deepen our knowledge. I would like to express my sincere gratitude to Dr. Joel for joining us and sharing his expertise. I would also like to thank to all of you for your commitment to excellence and your dedication to advancing the field of perioperative nursing. Without further ado, let's commence this international skilled lecture with enthusiasm and a shared commitment to enhancing perioperative care for the benefit of our patients worldwide. Thank you. Tatiana.
Thank you very much, sir. Ladies and gentlemen, we now move forward to our main event for today, that is to listen to lecture about holistic approach in perioperative patient care. I find this matter very important, sir, especially for our students, as our study program have specializing in perioperative nursing. And this time we're going to talk about a holistic approach during a perioperative period, which focus in treating patient as a whole rather than just addressing the surgical condition. So today we are very honored to have Dr. Joel Ray Utsang Akop, DNS SCRN, as the speaker today. But before that, I would like that Dr. Joel will deliver a presentation. So if any of you want to ask questions, you can type your name and the questions on the chat box below. And maybe later you can ask Dr. Joel directly later by raising your hand and just open your mic. So before the one last thing, before we are going to start the lecture today, let me introduce our speaker, Dr. Joel. Let's take a moment to appreciate his expertise and accomplishment by exploring his remarkable CV. All right. So Mr. Joel is respected faculty member in the nursing department at Visayas State University, Philippines. He began his journey in the field of nursing in 2010 as a registered nurse and advanced his education, earning a Master of Art in Nursing with specialization in medical surgical nursing in 2011, doctorate in nursing science in 2019, and postdoctoral fellowship at Erlangga University in 2021. Next. Yeah, next slide, please. Okay, Mr. Joel also expertise and field of interest encompasses caring science, elderly care, gerontology, nursing education, management, and many more. He has taught a variety courses such as nursing leadership and management with jurisprudence and also many more that you can see here. Throughout his career, Mr. Joel has held several significant positions. Maybe next slide. From clinical until academic position, as you can see, he is also the focal person for the Philippines Quality Awards of Visayas State University and co-chairperson of the Health Research Commodity at VSU. And additionally, he is an active member of the technical working group on the College of Medicine at VSU. Mr. Joel is also known for his contribution to academic and research As we can see here, he is affiliated with numerous journal and publication, serving as editor and reviewer. He has 6 citation to his work, and his high scholarly impact is reflected on his high index of 7 and I-10 index of 4, actually of 2023. We are very honored to have him with us today. So please join me in welcoming Mr. Joel to share his insight on the holistic approach in patient care in perioperative. Please, sir, time is yours.
Terima kasih. Thank you so much. I hope you can hear me.
Yeah, very clear, sir.
Okay. Allow me to share my screen. I'll go directly with my presentation about the holistic approach in the care for our patients in the perioperative period. So, this lecture is supporting the SDGs number 3, which is good health and well-being. 4, which is quality education, because after the engagement, you will be able to enrich your experiences and knowledge on the proper management of patients undergoing surgery, from the pre to intra to post-operative management, and partnership with a goal, which is SDG number 17. That's why we are having this lecture to strengthen our relationship with our university and to your institution as well. So, this is the emphasis or the objective of the lecture. I will not go deeper on the definition of perioperative because you already have an idea about that. What I will be doing now is trying to connect this concept of perioperative into the concept of holism. And we know that the person is more than the sum of its parts, meaning to say, it's not only the physiologic or the physical component of the patient that we are taking care of, more so with other domains or other aspects of the person's life. So we are trying to connect our own responsibility, our own role as a nurse, that of holism. And also, we will be carrying that knowledge into the perioperative, and we will be using some theories of nursing. Later on, I will show you my own theory of nursing and how this theory is applied to the care of a patient from admission down to discharge. Okay, so before that, since we will be talking about the holistic approach of caring person, it is also important that we have to look into the details of the nursing paradigm. And this paradigm tells us that whatever we do with your patient or whatever activities that you will be performing in the environment of nursing, you will be concerned on the 4 major components of this caring paradigm. Nursing is caring, we know that well, and embedded to that is the responsibility not only to the person, but also to nursing as a profession, the health, which is defined by the WHO, which is not only the mere absence of a disease. That's how WHO, the World Health Organization, defined health or wellness, and also the role of the environment in the recovering phase or while the patient is admitted to the hospital. We know that Florence Nightingale and his theory on environment highly emphasize that the environment is a crucial component towards the early recovery of our patient. And the role of sanitation, the role of environment must also be uh, given more importance while the nurse is interacting into the patient. So along with our discussion, we we will be talking the person not only as the recipient of care, but as a co-creator or as a partner in the decision making of whatever interventions they wish to receive. Although we recognize the person in this time as the one having a particular problem or health condition or health related problem, but they are also bound to give their own decision on what kind of help or what kind of intervention they wish to receive. Although there are patients who do not want to be assisted because they feel uh, abandoned or they feel solely dependent on the nurse provider, now especially on the elderly population. They do not want to be assisted because they feel useless and they feel highly dependent. But note that the person this time is referring to a person for surgery. The moment the person decides to avail of the service for surgery or operation, then that becomes a person of interest. So again, the person is the one receiving the care, and the care includes the nursing, the dependent care, or the collaborative care that we will be designing later on. And the person may not be the individual person, may not be the patient, but we include in our spectrum the family and the community or the important others as the one that will may take care of the patient right after discharge. Of course, after the surgery, after recovery, after time when the doctor decides to, discharge the patient, the, con- the continuity of care should be addressed. And this time, the community or the family members will do the continuity of caring on our behalf. So it is but important that while the person is admitted in the hospital, we also extend our education or health teachings to the important others. So that's the person in this picture. That is how we define person in nursing. The health is considered either the wellness or the illness state of a person. In the equilibrium of care, in the health or the illness wellness continuum, we recognize that the role of nursing is to maintain wellness and to prevent disease from happening. That's why we invested much on the promotive and preventive management over the curative. The curative that includes surgery, that includes giving of medications because there is already presence of a disease. But in here, in meta paradigm, we recognize that the health is the one that we will be like addressing so that the curative or the rehabilitative phases of the levels of prevention are also diminished or will not be addressed later on. So the environment is this setting where it can be defined to be internal or external surrounding of the person. The environment in terms of internal, this may refers to the person's ability to communicate or to connect with him or herself. That's internal environment. Uh, if the person believes of his desire to recover early, no matter how the nurse or how the members of the healthcare team provides, good health services, and the patient is not cooperative, therefore the patient has conflict, that of himself, that is internal in nature, that's still part of the environment. So there would be no increase of survival rate if the patient becomes less cooperative with the healthcare provider. External environment refers to the physical setup, refers to the physical environment where the patient is situated. So in the perioperative setting, in the intraoperative phase, we need to asepsis, or we need to maintain surgical cleanliness, or we have to adhere our own surgical conscience in order to decrease the rate of infection or complications after the operation. I am thinking that you already have the knowledge of surgical asepsis, no? Doing brushing, scrubbing, donning of your gloves and your scrub attire in the operating room. Those are external environment, and the surgical conscience would tell us that if you miss a portion of that process, or if you happens to what do you call this, experience problems of sanitation breaks, then you have to repeat again the entire procedure, even if nobody is looking at you, because it may lead into complications post-surgery. And that is external surroundings. Those are external environment. Another concern of external environment is the observations of sterility. That's why we do autoclave of our equipment, or sterilization or disinfection of our machines to be used for surgery, because the environment is contributive to the patient's rate of survival in the future. The environment is part of the nursing paradigm. Another is nursing. Nursing is the attribute or the characteristic of the nurse. So we have a nurse from the pre-op, prior to the surgery. We also have a separate set of skilled nurses in the intraoperative phase, the one that will do the instrumentation in assisting the doctor to have a smooth surgery experience of the patient. We also have a trained nurse that will continue to monitor the patient until the patient acquires consciousness after surgery. So this is nursing, and this possess different attribute that is to provide care in behalf of the healthcare team for the patient's welfare. So whatever discussions that we will be generating into today, it will always boil down to four major components of the nursing paradigm: the person as the point of reference, the health as the major component, one of the major component, the environment as a contributing factor to patient's recovery, and the of nurses and nursing for the patient's welfare. So we start with a general overview. This is only a general definition of perioperative nursing. The perioperative nursing, again, has three components. It is from the pre-admission, in the intra, wherein you will be conducting the surgery, and the post-operative, when the patient would try to recover from the effects of anesthesia in the intensive care unit, or in the peri-anesthesia care unit. So the perioperative is the care of patients for the entire duration of the surgery. And as I've said, this commences by the time the nurse able to meet the nurse or the patient in the caring environment. So later on, I will talk of a theory. When can we say that an environment is a nurturing environment? And when do we say that an environment is a caring environment appropriate for the patient's recovery? So that will be our discussion in a while. But again, in perioperative, there are 3 phases, and there are different nursing responsibilities in every phase of the said duration of care. So what are the phases? This is the more detailed illustration on the perioperative. There are 3 phases. The preoperative, wherein the patient and the nurse agrees to a certain point that a surgery is done as a part of intervention for patients' alleviation of pain or crisis. So this is the time wherein the preparation
There's a problem, Tatiana.
I think Mr. Joel facing a difficulty. Maybe you need to wait for a moment. Okay.
Hello?
Hello. Yes,
And
sir.
watch today.
Is there any technical difficulty? Sir?
Hello, can you hear
Yeah,
me?
I can hear you. So, can you hear me?
Yeah, can you hear me now?
Yeah, very clear right now.
Yes, yes.
I cannot see you. Oh, yeah.
Okay,
Oh,
okay.
no, I can.
Yeah, okay. I think there was a problem with our
Yeah.
connection here, so I need to transfer with okay. So let me share again. Okay. Like, can you now see my
Yeah.
screen?
Yes, sir.
Okay. Please do not hesitate to interrupt me if
Okay.
you cannot see or hear me talking, okay?
Okay. Sure, sir.
Okay. Okay. So where are we now? So we are now in the phases of perioperative. So I've said this is a more detailed presentation on the 3 phases. So the first is preoperative. Again, when the patient agrees to undergo or to avail of the surgery, no? Although we have different levels of surgery, we have elective surgery. Elective means scheduled surgery, meaning this is not emergent surgery. Example, if like in cesarean section, the woman is about to like deliver a baby on the unconventional manner, not with spontaneous delivery, but through cesarean section. Cesarean section is considered elective in nature because this is scheduled. So when there is an agreed time between the patient and the nurse and the members, the medical doctor, who is a member of the healthcare team, when they decided to undergo a certain procedure, then that is the commencement. That's the beginning of the preoperative. So in the preoperative, the patient will be able to learn what are the different preparations that he or she needs to undergo so that the procedure will become successful. Ideally, the surgical team or the surgeon will advise for a co-management to an internal medicine or an IM doctor that will give the consent to proceed with the operation. The consent I'm talking here is the CP clearance, meaning the cardio and the pulmonary clearances of the patient. So these are standing order or SOP, standard operating procedure, that we need to secure so that we would know if the patient is ready in terms of the cardio condition and the pulmonary condition. Why? Because surgery is a crisis that is need to be addressed, no? Or a stressful situation. And the fear of the unknown is the very common kind of fear that the patient may experience. It is called fear of the unknown because we do not know that at the course of the surgery, the patient may have a as a result of a stressful condition, the patient may experience arrest, cardiac arrest or respiratory arrest while at the OR theater or the OR table. Therefore, the surgeon will have to prepare all these requirements for ensuring the patient's safety during the intraoperative phases. So in the intraoperative, what we usually experience is the observation of the different procedure, the surgical procedure. So this is the time where we're going to conduct our gowning, our gloving, our skills of sterility and aseptic technique. Again, we're talking about the environment according to Florence Nightingale, which is very crucial to the patient's survival rate. So this is where the time the skilled nurse or a nurse scrub is responsible in the first-hand assisting doctor in the conduct of the operation. So I'm talking about the skilled nurse because the doctor will not talk much. The doctor will not verbalize whatever assistance he or she is needing, or the doctor will not ask you to a particular instrument, just the hand signal, just the non-verbal cues, and that you really have to grasp what the doctor is trying to communicate to expedite the procedure. So it is called the skilled nurse in doing the assisting of instrumentation. Until the patient able to be transferred into a peri-anesthesia care unit or the recovery area. This is where the intraoperative phase of nursing will end. In the post-operative, this is where the patient will be monitored critically. So the vital signs will have to be monitored every 15 minutes, and then for 30 minutes, and then per hour until the patient recovers from the operation, or until the patient is discharged from the hospital, or until the discharge will be evaluated at home setting after 1 week or 2 weeks post-discharge that covers the post-operative phases. That's why I emphasized earlier that in teaching your patient, you also explore the significant others in the said health education. Now we'll talk about holism. As I've said, holism is the concept that it is not only the physical component that we are looking after when the patient is admitted, although that is the most common impression of a nurse to always address the physiologic deficiency or the problem of physical deterioration, but that's only one component. The diagnostic examination would tell us the deficiency of the electrolyte and fluid imbalances. If you are conducting X-rays or imaging procedure, that will only tell us the physiologic component. But other components like the emotion and the spirituality, no procedure, no diagnostic examinations will be able to gauge and capture the deficiency of the person's spirituality and emotional well-being. Sometimes the person is happy or is always laughing, but that's external in nature. When we notice the patient keeps on, smiling and laughing, but they are hiding some ache or heartaches or emotional burden, that cannot be recognized by any diagnostic procedure. That's why it is called that sometimes the patients are very good, a very good pretender. They keep on smiling, they keep on laughing, but deep within, they have different emotional burden. And that's the concept of holism. We're trying to communicate, we're trying to read beyond lines of what the eyes can see. The physical component, the impairment, the deficiency, example, a loss of a limb or a fracture, it's only physical component. But the emotion and the spirituality that goes beyond what the eyes can see. That's why in nursing, you really have to have that skills or able to determine even the nonverbal cues of your patient. So in holism as a concept, this contains the property that cannot be discovered through the analysis of its parts. Although the person has lost a portion of his body following emergency or following vehicular accident, that doesn't mean that the person is less of a person. Okay? So even if the person loses his sight, it doesn't mean that the person is not complete. So in holism, we have to integrate all other domains of one's being, not just the physical component. So the spirituality have said, the context of sexuality, that's also part of holism. That's why about reproductive and sexuality as far as the Gordon's pattern is concerned. Okay? So what are the disadvantage of holism? The advantage, the good side of holism as a concept is multifactorial assessment. When you say multifactorial, it's not only focused on the physical. It's not only focused on the patient's physical or visual representation. Okay? As I have said, you are going to assess beyond what the eyes can see. Another is assessment of the mind and the body and the environmental scanning or analysis. Assessment of the mind because sometimes the patient may speak the exact opposite of what his mind is thinking of, or The body is expressing so different behavior than that of the mind is trying to communicate. So you have to see association, and it is the role of holism to associate, to have a parallel between the mind and the body. It is said that if your mind is thinking positively, it must be manifested by your bodily figure or behavior. But sometimes these mind and body are speaking exact opposite. Another is the environmental analysis. When you say environmental analysis, we always believe that a person is part of the inhabited environment, meaning that the environment is taking a portion of what the person at the moment. So the person may get sick because of the environmental condition. The patient may become well and okay because the environment is contributing to the wellness of the person. So environmental scanning or environmental analysis is also component of assessing the personhood of our patient. On the other side, the not so good or the negative component, if I may say, about holism is it is the perspective, making it broad and scientific becomes difficult. No, scientific testing becomes difficult, meaning we wanted to go too much onto details that we failed to recognize connection on all these dots. No, we're very much concerned about the micro component because we wanted to, investigate even the smallest form or the smallest component of the person. And later on, we left hang or we left unknowledgeable if how are we going to associate all these tidbits or other components or minute components to the totality of the person. Okay, that's why it needs a very good nurse or health provider to associate or to connect all these information. Okay, so what are the approaches to perioperative nursing? I use the word malang for you to remember that in the care of the person or the care of the patient in the perioperative, let us also remember that the nurses really have to take care of themselves first. It is a no-no. It is not advisable that we always look much attention to our patient, and yet we are taking care less of our being as a nurse. So we should not engage into activities that will jeopardize our health and well-being as well, because we will not become effective or efficient in the management of patient care if the nurse himself or the nurse herself is also not acquiring, good health and proper nutrition, or as I've said, the well-being of the nurse as a care provider. So what are the approaches? Number one is meditation. This is a non-pharmacologic management. This is, yes, non-pharmacologic management. And meditation is an example because holism also requires spirituality. So your personal connection with yourself, if you remember about the environment to be internal and external, if you are not attuned, or if you are not in constant communication with yourself, then there might be some confusion or complication later on. And how we can be more effective in the management, in the delivery of our care to our patient, if we ourselves experience crisis or complications from within. Therefore, meditation is important I am not saying that meditation should always starts with a prayer. Sometimes it connects with your own being or listening on the voice within. Okay? So meditation is a connection, a relationship between you and yourself for you to be more efficient and more effective in the care towards other people. So that's the first approach that you have to consider, meditation for yourself. Another is active physical workout. This is addressing the physical requirement of holism. So as you notice, the active physical workout is still a non-pharmacologic management. We do not use medications. We do not intake any medications just to maintain our wellness or health status. Okay, so it is suggested in science. It is suggested in science that at least we have a 30-minute workout or exercise or physical mobility at least every day. That's physical active engagement. Another is leveraging fit and healthy body. So how do we do that? Is through diet, healthy diet. No? So still the nutrition and the intake of food, those are also crucial component for our aim of being effective perioperative nurses. Another is acquire attitude of positive intellect to people surrounding you. So that means to say that a toxic environment is also a way of, not being able to effectively deliver your care. So it must be a good working environment, a good working relationship with other people, and the positivity, the power of positive thinking is also a critical component to become effective care provider. Another is nurture connection and spirituality. So this is the same thing with meditation, and get use of modern and traditional treatment, meaning to say that you always have to engage in an active learning environment or active learning space. You will be finishing your degree after 4 years maybe, and you will become registered nurses. But that does not mean that you'll all learn the things that you needed for efficiently performing the art of nursing. You have to enroll additional units for your masters or proceed with your PhDs or acquire micro credentials or to have some certifications to take a lot of exams. That is to sharpen or to define well your craft in nursing. So that is traditional treatment or get used into modern technologies. Of course, right now that we are in the era of technology, and this technology and the sophisticated material are also part of our expressions of doing the care. So in the hospital, there will not be of equipment or tools that would help to assist to better our delivery of care. And as a nurse, you have to learn all of this so that you'll be more efficient in your management. Okay, so I'm talking now about the theory application, which is the caring as an ending expressions in nursing. And I am able to publish this in 2018. And the nurturing environment, as you can remember with the meta paradigm of nursing, environment is important. So when do you know that an environment is a nurturing environment? Remember, and I have to tell you this early, that not all environment is needed, or not all environment becomes a good avenue for the patient's recovery. There must be a nurturing environment or a caring environment. So we can only acquire a nurturing environment if the four major components of the QN theory is present. Four are present. One is appreciation, another is communication, third is offering option, and the last one is bilateral implementation. So let's go this one by one. In appreciation phase as a nurse, you have to recognize that the patient is not an object of care, but as a co-equal participants in the delivery of care. This is where some nurses fall short because we believe the patient is only receiving component of our care practice. Remember that the patient has the right to refuse whatever treatment, even if you know the patient may decide half-baked or half knowledgeable. That's why it is your role to really expound your teaching and to deliver the teaching based on their level of understanding. So if the patient may be not able to, grasp the information because of the medical jargon or the words that you are using is too much for a person to understand, then it is your role as a nurse to reframe or to restructure your teaching until such time that this will be understood to the level of understanding. So that's appreciation, recognizing that the patient is not just an object of care, a recipient of care, but as an equal participant in the delivery of the management. That's appreciation. And holism is part of that. You have to appreciate that the person, no matter the culture, no matter their religious affiliation, no matter their strata or stratifications in the society, whether poor or rich or unable to pay their bills, they have to be considered as a co-equal participant in the care management. That's appreciation. Okay. And in the appreciation phase, you acknowledge the person to be whole and complete being with no infirmity. So, example, if the person loses his or able to, lost his limb or a portion of the body is defective because of an ailment or because of the vehicular accident, do not consider the person less of a person. That is still a whole being because we recognize holism, not only the physical component, but even the emotion, the spirituality, the economic status, or even the sexuality of the person. So you have to holistically recognize the being, that person as a being with no infirmity. Another component is communication. So again, communication is critical when we perform perioperative care. So remember that in the pre-op period, the preoperative evaluation, this is more or less establishing the patient's level of health. So if the patient before surgery decides to undergo the procedure, then you have to prepare not only the physical, but also the cognitive, because we wanted to avoid the fear of the unknown as a complication later on. Okay, bleeding, infection, these are common complications post-operatively, and that could have been prevented if there was good communication, establishment of good communication lines preoperatively. So if the patient is wanting to undergo the surgery, you have to prepare the diet, you have to prepare the resources as well, and you have to explain to them, that's through communication, what are expected, no, at the course of the operation. Although we should recognize the role of the surgeon being the captain of the ship, meaning to say the doctor, the medical doctor, the surgeon is the one asking for consent, or is the one entitled to explain in details the pros and the cons of the surgery. And should the patient wanted to have more enlightenment, then it is the role of the nurse to perform reinforcement teaching. That's part of our ministerial role, to do reinforcement, no, for the said education. That's communication. In the hospital, in the operative room, communication is important, as I have said, to expedite the process, to decrease the chances of error. You have to anticipate your need of your surgeon or other members of the sterile field. So we have there the surgeon, we have the assistant surgeon, we have the scrub nurse, even the anesthesiologist is communicating to you non-verbally, and that is part of your communication. So again, communication is very important or very much needed in your education. Another is bilateral implementation. As a nurse, if you remember about the paradigm, there are only four major components: the nursing, the environment, the person, and the health. That's the nursing paradigm. But the nursing process is different. The nursing process is the ADPI, from assessment to diagnosis to planning to implementation to evaluation. So it is expected of a nurse that when you perform procedure, when you implement now your plan of action, you could have gather as much information that's through assessment, both the verbal and the nonverbal cues, so that you will have a basis during the evaluation if the implemented interventions are fitting or they need to be enhanced as you are performing your nursing procedure. So again, in the nursing process, it always starts with assessment, recognizing, appreciating person. Diagnosis, I'm talking here of the nursing diagnosis. The plan is based on the acquired data, while the implementation is dependent on the kind of plan that you have generated, while the evaluation is cutting across the phases of the nursing process, meaning you can evaluate even if you have not started the implementation phase. You can evaluate while in the planning phase. So you would say, you would be evaluating if the plan is correct based on the assessment cues, or you would be evaluating in the assessment phase if you already gathered all the necessary cues, subjective or objective data to properly implement your intervention. So all these phases, evaluation can come in. Now, in terms of management, in higher management level, you also have your PDCA cycle, your plan, do, check, and act. And this refers to the continuous quality improvement of our care. So in the operating room, in as much as we wanted to deliver efficiency of care, we should also subject our processes into CQI, or the continual quality improvement. So in the hospital, we have the JCI, or the Joint Commission on Hospital Accreditation. That means to say that your processes are within acceptable standards, universal standards at that. That's why in the intraoperative phase, we have what we call a universal timeout. So before you start with your procedure, you have to perform the timeout phase, meaning you have, the circulating nurse will ensure that the patient in the OR theater is really the patient intended for that surgery, so that we will not miss any of the processes in our procedure. Or are we certain, are we sure that the surgery is intended for the patient? Maybe it's the patient on the other room that needs amputation of the leg, and because you have not performed the universal timeout for continual improvement, you wrongly administer the procedure to another patient, and that is non-acceptable in the sight of the quality improvement. Therefore, it is the role of the perioperative nurse, still in the holistic approach, to be always planning along with the members of the healthcare team, doing what is best based on the plan, checking as to the implementation of the approved plan, and acting based on the standards. So that's bilateral implementation. So the higher nursing tells us that we should not only be focusing into the nursing process, but we have to incorporate the concept of management, the concept of international standards into our practice. Again, the reason is we need to provide better, if not the best, care to your individual patients. Another is, okay, I think this is my last slide. As you can see, this is the typical picture in the operating room. You notice the patient is lying on bed. The anesthesiologist is right next to the head of the patient. The surgeon, along with the members of the scrub and the circulating nurse, somewhat they are helpless, as you notice. So this is the anesthesiologist, this is the surgeon, the other members of the team, maybe the scrub nurse or the scrub nurse or the circulating nurse, and the patient is lying with a significant amount of blood loss. What can you say about the picture? What have you noticed in this picture? So they feel tired, they feel like overworked or burdened, maybe because of the long time spent in the surgery, in the surgical procedure. But what I'm trying to say is, as you notice in this wall, there is the patient looking up into the body, his own body, on flat bed. So maybe you can generate a lot of opinion or perspective while looking into this. Maybe you would recognize that the patient's like soul or spirit is like detaching that of the physical body, and this spirit, the spirituality component is part of holism, but it's slowly detached from the physical body of the patient. Maybe the patient is dead. That's why some of the like members of the surgical team are like feeling sad or depressed because they were not able to provide the best care. The patient died because of blood loss. That can be another version. That can be a version of this story. Or another thing is the patient is critically ill, and they're trying to survive the patient. and this patient is looking into from a distance and maybe would say that it's okay. You did all your best, you did all what you can just to save my body from an ailment or from blood loss, but the patient was not able to recover. So all of these boil down into a common concern, which is to always see a person not just a physical component, but also looking to the other domains of his individuality. So it is crucial, your role as a nurse in perioperative is crucial because you may be that thin line that will describe or that will be the basis for patient's survival or for the patient's defeat. So if you will not study, it may lead into the patient's immediate death. But if you study well your lessons before going to a certain operation, then you are that defining line for the patient's survival. So again, when you study, when you perform your nursing task, always look into the welfare of your patient. When you pass your licensure examination, it is not you that will be rejoicing. It's actually the community as your point of area where they will be receiving a safe conduct of nursing practice. So our license is a determining factor whether we are conducting safe nursing practice to this community as a recipient of care. So that's holism. You study well because it's not for your own good. It is to ensure the consuming public that they are receiving safe care from a safe practitioner. That's the reason why you have to take your licensure exam seriously. Okay, so that's how I see perioperative as an approach. I think that's the end of my talk. I hope you learned something from that talk. I'm now open for the question and answer.
Okay, thank you very much, sir, for the very valuable insight. Now, if I could share with you some key point of Mr. Joel lecture, that is the holistic approach in perioperative care emphasize treating patient as a whole, as the nursing paradigm that include person as the patient, nursing, health, and environment. We are now going through the Q&A session, sir. Maybe if some of you want to ask question to Mr. Joy, you can type on the. Oh, there's someone raising hand. Husni Mubarak. You want to ask directly to Mr. Joy? So please unmute yourself.
Yes, thank you. Thank you, moderator. Maybe I want to ask to Mr. Jule about this matter that you have explained to us about preoperative patient often experience anxiety in the preoperative area. Do operating rooms in the Philippines use music therapy in the pre-medication area of the operating room, sir? Thank you.
Interesting.
Okay.
So please,
Yes.
Joe.
Yeah. I mentioned to you that the fear of the unknown or the anxiety and depression are common experiences of the patient prior to surgery. And the use of music therapy as one of the non-pharmacologic management is also a helping method to ease their bouts of anxiety and depression. But be very cautious in using music as a form of non-pharmacologic management to decrease the amount of pain or anxiety and depression, especially if that has something to do about the cultural affiliation of your patient. Example, if you will be using Christian songs or religious songs and the person has a different cultural affiliation, that music therapy as an intervention may not be helpful at all. Or if the patient will undergo a diagnostic procedure like the MRI, the magnetic resonance imaging, wherein the patient has to be placed into a tunnel-like structure, and you will use like religious songs, and the patient has, you know, fear of closed spaces, a claustrophobic, the music therapy may not be helpful at all. But then again, in an overall illustration, music therapy can actually calm the anxiety or will lessen the depression of the patient in preparation for a surgery. But again, in our experience in the Philippines, even doctors will use music or will play music while doing the surgery, not only for the patient. Yeah, because that will make, you know, some a lighter like mood in the environment. As I've said, because surgery is a what again? It's a demanding procedure. It is a stressful condition. Some experiences, other surgeons will perform surgery at the middle of the night so that there will be peace and calm environment or cool environment where everyone is at least free or safe from this an anxiety or depressive environment. But then again, it's a good point that you highlighted the use of music as a form of non-pharmacologic management to address the anxiety and depression prior to surgery. Thank you for that.
Okay, thank you, sir, for the explanation. So it is a good approach, right, sir, for anxiety in especially perioperative phase of patients. And of course, again, we should take attention to what kind of treatment that the patients going through, and also the background of the patients, such as spiritual and cultural. So maybe there is another question regarding Mr. Joe lecture? Or is there anyone that wants to ask directly to Mr. Joel? Still waiting for the question. We still have about 30 minutes for this Q&A questions. Maybe, sir, I have a very curious about the approach to perioperative nursing that you are telling before in the acronym of MALANG, and G stands for get use of modern and traditional treatment. Would you like to explain how is the traditional treatment in Philippines for perioperative patients?
Yes. The modern treatment that we have, what I'm trying to say is to be always open for the different changes or approaches. As we are advancing our care towards the patient, of course, there are Western kind of treatment, the one that is introduced by, you know, advanced countries. We are still part of the developing communities, and therefore most of the treatment are provided from Western culture. So, and sometimes the economic component is not helping or is not supporting when we subscribe to this modern mechanism of treating diseases. That's why I made mention on the modern treatment, because if you have the capacity maybe to advance your care, especially on terminal diseases like cancer, and the management is not yet available in our setting, it might be a welcoming development that you will be referred to higher facility or maybe flew abroad to do the advanced management. But if in case we do not have that that luxury of resources, then we need to maximize the resources that we have in our place. Say, for example, if we have the non-pharmacologic, that's why in the acronym that I developed, it's more on the non-pharmacologic management. And if you notice, those are doable interventions like the meditation, because it's always in the holism, it's always the union of the different domains. It's the union of the mind, the body, and the spirit. So if there are alteration to these three connections, then there will be existence of a problem or a presentation of the signs and symptoms. Sometimes we have what we call a somatoform disorder or somatic disorder, psychosomatic disorder. The psycho is like the mind generating the signs and symptoms, but it is only originated in the mind. That's how the way we think. If you think so negative, if we think so so toxic, then the body will present the signs and symptoms. And sometimes we cannot explain why we are having this kind of disease when in fact, when we submit ourselves to diagnostic procedure, all the diagnostic results are but normal, but why you are experiencing the disease? It is not in congruence because your mind, the body, and the soul are not in harmony. So it is the goal of holistic nursing to harmonize these three major components, and that will boil down into a presentation of, wellness, a presentation of good health practice. Okay, so those are the subscription to modern treatment, subscription to treatment that even if that is not available in our locale, but the approaches, the one that I provided is very much doable. Yeah.
Yes.
So that's how I explained about the subscription to the treatment.
All right. Thank you very much, sir. We have another question, sir, here from Leah. Nella. Yeah. How is not nutritional management of post-operative patient in the Philippines? Is it the same as in Indonesia? Many people are afraid to eat eggs and meat after surgery. Oh, yeah, it's like a myth here, sir, that some people believe that post-operation patient cannot eat eggs and meat. Due to some belief.
You know,
Mhm.
the goreng and the nasi goreng are very delicious, and those are some of the meat that we can provide to our patient. These are myths. These are, like beliefs that must be corrected on the point of the nurse as a provider. If you remember that in the post-surgery, the patient has acquired wound that has to be healed, and the eggs is very much rich in terms of protein that is needed for wound healing. And the meat also has protein component that is good in the healing process, the wound regeneration. So if that is the myth of our constituents, then if you remember the QN theory, which is communication and appreciation, you have to communicate to them that this myth is, of course, it's myth. It's not true. And in as much as they wanted to avoid eggs and meat after surgery, the more they have to subscribe to that because it may help them in the faster healing process. Maybe I am not certain about the meat or if that will yield into intake of meat or intake of too much egg may lead to constipation, for example. And if they will, do the defecation or elimination pattern, it may lead into the intra-abdominal pressure that may increase the pain in the surgical site. That's why they avoid eating meat. But we have a lot of mechanisms in order to like ensure that their wound, example, in the abdomen is not like affected when they have some elimination pattern. So it's about the proper diets and nutrition that we have to give them much emphasis over than avoiding eggs and meat as a component of their diet. So again, it is, but if they really do not want to have to eat meat and to have egg as form of protein, then we can look for some alternative. And the aim is to help them with their wound healing process. So in the Philippines, I think we have similar understanding. But what is important is we give continuous teaching and emphasis on the importance of nutrition as part of the rehabilitative or the healing process of our patient. So maybe the egg or maybe the meat, may some of the myth or the misunderstanding of our patients. There's a lot. Others do not want to take a bath after surgery because that is not acceptable to their culture. But remember, sanitation is important. And bathing or cleaning the body is important component for rehabilitation. So if the patient refused to take bath, same as refused to take eggs and meat post-surgery, then it is the role of the nurse to emphasize or to re-educate them on the importance of this as part of the healing process.
All right. So communication, of course, is the key, right, sir, for these kind of misconceptions. And also, we cannot just point out this nutritional myth, but we also need to address like personal hygiene and so on, so we can treat patient as a whole. So another question, sir, from Fauzan. What is the management of early ambulation, which is often carried out in Philippines hospital after surgery? Is it the same as Indonesia? At least tilting right and left every hours. What? Okay.
Yes. Ambulation is encouraged after surgery because because we wanted to prevent the deep vein thrombosis, the DVT, the deep vein thrombosis. So after surgery, if the patient is conscious, we have to encourage them for early ambulation. If there is abdominal surgery, we have to prepare them with their abdominal binder, yeah, or intact dressing, or to provide pressure in the abdominal area so that when they mobilize or ambulate, at least they would have a feel of not really like bursting sensation into their abdominal lines. So yes, ambulation 2 hours, turning to sides, that's tilting left and right every 2 hours are also observed in the Philippine setting. What is the most critical role of a nurse in doing ambulation is the safety and security. We do not ambulate the patient post-operatively if you see or if you anticipate some degree of safety issues. So when the patients feel like lightheadedness or an increase of blood pressure or unstable gait because of the effects of anesthesia, then do not force the patient to ambulate. This may lead into another problem such as fracture, or you have to to raise the side rails to ensure the patient will not fall from bed as an effect of anesthesia. So ambulation is encouraged, but your nursing responsibility is the security of safety to your patient all times. Do not leave your patients unattended. Do not ask the patient to go to the bathroom or to the comfort room all by herself. You have to assist them because they are still recovering, no, from a particular procedure. So before you let the patient stand for ambulation, you have to dangle the feet to ensure circulation of blood is sufficiently distributed into the leg area, which gives further stability when the patient stand up. Okay? So that's safety, that's ensuring the patient is secured while doing the ambulation practices to prevent some deep vein thrombosis or the DVT, okay, into the patients.
All right. So, in top of all, patient safety is number one, right, sir? We should avoid falling risks for the patients. Maybe if there's any other questions, or if you want to ask directly to Mr. Yo. If there's no other question, maybe.
By the way,
Uh-huh.
I shared to you my material in the chat. I hope you can access that one. You can also have my email and my WhatsApp to communicate me more about the material, or if you have some concerns or questions that you may be able to acquire while after the presentation. You can still message me in my email or in my WhatsApp.
Yes, thank you very much, sir. So, ladies and gentlemen, if you are want to ask a following question regarding a holistic approach or maybe another expertise of Mr. Joel, you can ask by the contact that is available on the presentation. So, if there is no other question, I think that's all for our session today, sir. I would like to say thank you very much for the valuable insight in holistic care, especially perioperative. We would like to share our certificate of appreciation, sir. It will be delivered by Dr. Arif. Sir, please.
Okay, Mbak Tiana. Thank you, Dr. Joel. Thank you for your insightful presentations already. I will present the certificate for you. This certificate is a token of appreciation of institutions to you for gracious sharing your knowledge and insights, particularly in the holistic approach to perioperative patient care. Please kindly accept it. Thank you.
Thank you so much.
Thank you so much. Once again, thank you very much for joining us today, Mr. Joel, and we hope to see you again maybe in the next opportunity. And ladies and gentlemen, I believe that's all for our discussion for today. It is my great pleasure that we have fruitful discussion. I would like to say thank you very much to our distinguished speaker for your valuable insight and sparing your time to share with us today, Mr. Joel. And hoping our institution can keep working together well in the future. Hopefully, it can be beneficial for all of us. And finally, wassalamualaikum warahmatullahi wabarakatuh. Good afternoon.
Thank you very much, Pak Dr. Joel.
Thank you. Thank you.